This is Larysa Dyrszka, who's a pediatrician and also has become an expert in health impact assessments. Larysa, what I'd like to ask you today is to tell me how significant a health impact assessment would be in New York State with regards to hydraulic fracturing. And could you tell us first a little bit about what a health impact assessment is?
A health impact assessment is a process that includes many public health tools, which involves possibly surveys, researches, the current literature on the issue, and the literature search could be from elsewhere in the country, anywhere where hydrofracking has been done previously. And we have a couple that have been done in Battlement Mesa, Colorado by Roxana Witter and her colleagues, and also by Aaron Wernham in Alaska. That was under a NEPA process. So they included their health impact assessment within an environmental impact statement. And it actually is very similar to an environmental impact statement in that the steps involved include a screening to determine if a health impact assessment actually would add some value, a scoping to determine what the population is that you will be studying, what the potential impacts might be, the area that you would potentially study, and the tools that you would use. And so you scope all of that out, and you include many stakeholders. It's a very transparent process, and that is what we feel would be very beneficial in an excellent addition to the current environmental impact statement in New York State, because they have not addressed the health impacts adequately in our estimation, and because the value would be tremendous because the community impacts haven't been addressed adequately. Workers, vulnerable populations such as children, the elderly would all be introduced. This hasn't been done previously in New York State.
What about in areas that are already undergoing hydraulic fracturing, such as Pennsylvania? Is there any utility in such areas for performing such a impact assessment?
That's a more difficult question because in an area where there is already hydraulic fracturing, it's hard to get the baseline information because you've already impacted the population. So the best time to do a health impact assessment is before the industry, before the exploration and production phases have come into a particular area. So in Pennsylvania, it could still be done, but because there are some areas, for example, in the Delaware River Basin that haven't been impacted by this industry. So it is possible in some areas of Pennsylvania to do a health impact assessment, but really you would want to have all of the information before you actually start. This is supposed to inform the decision makers. And if you do it afterwards, well, the regulations are in place, the process is in place, and it's much harder to move forward with the health impact assessment once the process is in place.
So therefore, having a policy decision being contingent on this process as it is already on an environmental impact assessment is the logical way to go.
Yeah.
And if that's the case, then you need to have, as the stakeholders you've mentioned, individuals representing the policymakers, the administration of that jurisdiction, and perhaps also industry as well, alongside representatives of the population. Is that correct?
That's right. The stakeholders would definitely include the industry. Mm-hmm. The very important stakeholders are the decision makers. And you are aware that New York State legislature has expressed interest in this, particularly the New York State Assembly. The New York State Assembly has several months ago included it in their budget, and then just recently, before the legislative session ended, they passed a bill with an overwhelming majority of 128 to 17 to start a health impact assessment prior to gas drilling occurring starting in New York State, so that they could be informed, they could make laws that would be protective of the people, regulations that would be in place before this industry impacts the health of people.
So tell me, what are the possible outcomes of a health impact assessment?
Usually three general categories, which are that the health impact assessment finds that there is not going to be any health impact, and so you move forward with a particular land use decision. And just to backtrack a little bit, health impact assessment is recommended for any land use decision, and a group, the Health Impact Project, together with the University of Arizona's James Hodge, put together a very, very good legal review of using health impact assessments in non-health sectors. And this would be one of those categories. One should always ask, is health going to be impacted? So number one would be that there is no health impact, and you move forward with the decision. Another is that the health impact assessment offers recommendations for mitigations. And for example, in the Battlement Mesa, there were, if I remember correctly, over 60 recommendations on how mitigation could be implemented so that there would be fewer impacts on human health. And then there's a third option of no action, which is that if the project is deemed to be too much of an insult on human health, then that project should not move forward.
So is it difficult to recruit stakeholders when you have that range of options?
There might be some resistance, but if the stakeholders are not at the table, then they can't offer their opinions. So we would want this to be a very transparent process. And so all of the stakeholders would have a chance for their input and to offer, for example, if there's a mitigation that could be offered, that should come from industry. Mm-hmm. And so they should be at the table so as to be able to offer a mitigation. If they can't offer a mitigation, well, that's an impact that would not have some sort of recommendation to improve human health. You see, the whole purpose of a health impact assessment is to maximize positive health outcomes and minimize negative impacts. And
it seems to me that there needs to be a certain amount of transparency in order to go forward with this. For example, we need to have some knowledge as to the sorts of chemicals that are being used in the drilling muds or in the slick water, or else it's difficult to consider what their impacts may be, or in the flowback or the volatile emissions. Is that the case? Or can you proceed without that kind of information?
It would be helpful to have that kind of information if you're going to be doing a risk assessment, but risk assessments are a part of the project of a health impact assessment that could be a recommendation for future study. So not all of the steps, not all of the research has to be done during the initial part of the health impact assessment. So we know already that there are impacts from several toxic chemicals, for example, benzene, 2-butoxyethanol, toluene, xylene, radioactive materials. So we know that those either are put down into downhole or they're brought up. And those are, in my opinion, enough chemicals to begin at least a risk assessment. But there's so much more to a health impact assessment. The community impacts, which really don't depend on knowledge of the particular chemicals. And those could be done via surveys and in areas where the gas drilling has already occurred, and knowing what kinds of impacts have occurred elsewhere, anticipating such potential impacts in an area where you expect it to be occurring in the new proposed area you could extrapolate and ask questions about how would you feel if such and such an event occurred. So there's a lot of creativity in doing a health impact assessment and formulating the surveys and obtaining expert opinions.
Yes, this sounds to me like a process that takes some time, and that during that process, managing to keep the commitment to it depends upon a steady funding stream. Also, people who are engaged in the process who are not likely to change because of elections or other such things during that process. Is there any way, are there examples of health impact assessments which have managed to stay the course and hence influenced the final outcome for when industries have come into areas?
Yes, there are several health impact assessments, if you look at the Health Impact Project site, which actually were legislated. That's not the majority of them, but many of them are done with either municipalities or other interested parties, the decision makers, which have decided that they will look at the results of the health impact assessment before moving forward. Mm-hmm. But there are some that have actually legislated that we will look at this health impact assessment, take it into consideration before moving forward. So that's the most logical way of doing it. And for example, in the in Alaska, with the population there, the Lake Teshekpuk was slated to be drilled, and the results of the native population, their health, their community impacts, all of that appeared to be problematic if they were to continue with the health impact assessment.
Yes. Just to conclude, if the health impact assessment is performed according to the sort of approach that we're talking about, and as we're both evidence-based professionals being in the medical profession, what is the relationship between this kind of process and the kind of evidence base that we use in medicine, which we read about in medical journals, which we use in the practice of ascertaining the practice guidelines for our profession, or, for example, to meta-analyses, which we read about in medical journals?
Well, it is science-based, and there is a lot of meta-analysis because you're using information that is obtained from other sources where it's either happened before or you're analyzing literature. So it's really a science-based study. Mm-hmm. It is unique in that it uses many tools, and some of which are not quantitative but rather qualitative. Mm-hmm. And that is something that's very important because it's very difficult to assess, for example, the community impacts without taking a holistic qualitative review.
Okay. Well, I really thank you on this Sunday for speaking with me about this, and hopefully we'll get you back and talk about it some more. Thank you.
Thank you.